Hi, I'm Tom Daschle. I'm the leader of the Transition Healthcare Policy Team, and you remember my friend and colleague Lauren Aronson. We are just so pleased that so many of you have already written in. About 3,500 people have already commented, and given the fact that this was a holiday weekend where millions of people were traveling, it's all the more impressive. I spent a lot of the weekend actually reading the comment, and I have to tell you, I'm extremely moved by a lot of the stories that you've shared with us. We want to keep this a very open process. We want to make sure that you understand how important those comments and your contributions are. We really want to hear from you. And already we're begun to follow through with some of the ideas, and Lauren's going to outline a few of those right now.
One comment that we heard a lot about was from a person named KLLMT, who said all Americans would benefit from a paradigm shift in healthcare, and one that emphasizes preventative care and addresses the cause of illnesses above treating symptoms.
She's absolutely right. Yeah, it's exactly. That's what I hear as I travel all over too, is that we really need to put the kind of emphasis on prevention, because if you can keep people well, you're not going to pay so much once people get sick.
Right,
and that's exactly what she's saying here.
Right, and also I think affects American companies and businesses, because you have a healthier workforce and people are not taking off time to be in the hospital or be sick at home, and they're being productive citizens working for these businesses and companies.
That's right. That's right.
Another comment that they thought was actually very interesting was from KKDC, who suggested that we set up a kind of health corps, yeah, like the Peace Corps,
right,
which is a fantastic idea. So you can have folks who are in their finishing college and medical school and nursing school go straight back into the community and give back to their country. It's a very interesting idea.
I like that.
Yeah, so do I. I think it's something we should definitely look into. And unfortunately, our friend Dora, who did the video with me last week, is still visiting her family for Thanksgiving. When she comes back, she's going to take a lead on looking into that issue.
Great.
And another big issue we talked a lot about, that was talked about online in the discussion, was on cost containment, and what a big issues we need to face as we look at trying to expand coverage. We also need to contain costs for those who do have health care.
I think it's one of the biggest issues driving this whole healthcare debate. As I talk to businesses and families alike, everybody is saying if we can't control costs, we haven't solved this healthcare problem.
Right, I think you're right on, Senator. And I think Margaret, also a CEO and founder of a large nonprofit corporation, would agree. She provides health care for 52 full-time employees with health care, and has been struggling to find a way to provide her part-time employees with health care as well. And it's such a vital issue that we're facing.
Those are the stories that I think have really got to be compelling for legislators. I mean, I know when I was in the Senate, it was stories like that, probably more than all the factual information, that really moved you to want to act.
Right, absolutely, absolutely, great. Well, we really appreciate all the comments that we got. Senator and I have spent a lot of time over the weekend, the last couple of days, looking at them, and I think we're really going to try to incorporate all the ideas that we got, because they really were just fantastic ideas from the American public. Thank you.